many people are taking proton pump inhibitor (PPI) for some years. Only few of them know the potential side effects of long-term use of PPI. I use the mnemonic pumps PUMPS to remember the side effects of PPI. P. Pneumonia. In 2003 to 2004, JAMA presented the association of community-acquired pneumonia with PPI in a retrospective study conducted in patients with acid reflux disease. Later in year 2015, of the 26 studies included in one meta-analysis, 15 reported a statistically significant increased risk of pneumonia with PPI use, and 11 studies reported no statistically significant association. The meta-analysis identified a significantly increased risk of pneumonia with outpatient PPI use. However, this relation was not found among patients using PPI and NSAIDs. The association between PPI and risk of pneumonia is still debated because acid reflux disease, being a risk factor for pneumonia, appears to be a major confounder. Urine kidney injury. Two meta-analyses in 2017 and 2018 of observational studies involving more than 2.4 million patients showing that PPI users had an increased risk of acute kidney injury. Furthermore, it has been shown that the risk of kidney injuries is higher in PPI users compared with those taking H2 blockers. However, these findings were based on observational studies. Additional rigorous studies are needed for further clarification. M. Malabsorption, especially magnesium. It has been widely demonstrated that long-term use of PPI can cause a decrease in serum magnesium level. There were 13 cross-sectional studies, 2 case control studies, and 1 cohort study with a total of 130,000 patients. 7 studies originated from North America, 6 studies from Europe, and 3 studies from Asia. The studies were published between 2012 and 2018. Among PPI users, 19.4% had hypomagnesemia compared to 13.5% among non-users. By meta-analysis, PPI use was significantly associated with low magnesium level. It was also pointed out in the US Food and Drug Administration Drug Safety Communication of 2017. Acid secretion in the stomach has a relevant role in the absorption of nutrients. Although many people postulated that long-term use of PPI reduces the acidity in the stomach, causing reduction of absorption and digestion of some minerals and vitamins. However, other studies did not demonstrate the association at the moment. P. Polyps. A Netherlands study group analyzed data from 12 studies, comprising more than 87,000 patients, 1 randomized control trial, 6 cohort and 1 case control studies, reporting the effects of PPIs on gastric polyps. Based on a systemic review with meta-analysis, long-term use of PPI more than 12 months is associated with an increased risk of fungal gland polyps. PPI may be associated with an increased risk of gastric cancer. However, this association does not confirm causation. S. Skeleton bone fracture. In 2011, the FDA published a document reporting an increased risk of bone fractures in patients receiving PPI. This association was first noted in 2006 in a case control study. Since then, many other studies have evaluated the association between PPI use and the risk of bone fractures. A meta-analysis including 32 observational studies involving 2 million individuals confirmed that patients taking PPI have an increased risk of not only hip fractures, but also other site fractures. Another meta-analysis based on 24 observational studies involving more than 2 million patients showed that the risk of hip fractures was significantly greater in those taking PPI compared to non-PPI controls. An increased risk was also reported for both medium and low-dose PPI, whereas no association was not observed for H2 blockers use. Others, the association between PPI and cardiovascular risk disease has been debated and remains controversial. For most other side effects, the available clinical evidence is weak or contradictory, and no clear association with PPI use can be identified. In these cases, the benefits of PPI seems to outweigh the potential adverse effects. Recommendations for further reading. A journal article in 2021 by Castellana, Side Effects of Long-Term Use of Proton Pump Inhibitors, Practical Considerations.